And there's also worrying reports for Ebola Free African nations. The World Health Organization has been assessing which African countries could actually handle the crisis in case there's an outbreak. As CCTV's Kiyo reports, apparently only 2 countries are up to the challenge.
Very good morning to you.
So far, they've kept the East African region safe. But for how much longer? Representatives from health, immigration and transport ministries across East Africa met in Nairobi on Tuesday. The theme, their success in keeping Ebola away.
We at the East African community, we have this agreement that enables people to move freely across the borders. So it means that at that point, we need to seal our borders and ensure that the people within the region are not affected by Ebola.
But the World Health Organization says much more needs to be done. It's citing its own research on African preparations for Ebola.
We only have Algeria and Ethiopia that can be, based on what they reported, that can be termed like they are fully prepared to handle the Ebola outbreak. We do have 19 countries that are partially prepared, which means some work needs to be done to be able to manage.
Every other country is not prepared at all and would need the sort of help Liberia, Sierra Leone and Guinea are seeking. The World Health Organization recommends African countries actually send their rapid response medics to Ebola regions for at least 2 weeks to get an idea of what they'd be up against should the worst happen. Well, the Ebola virus has caused much havoc in West Africa, but the World Health Organization reckons the worst is yet to come. In 6 months, WHO is warning that Ebola infections could be 4 times the current figure of 5,000, meaning other regions like East Africa still run the risk of registering cases. Kiyo, CCTV, Nairobi, Kenya.